Professor, Physician, Epidemiologist. I am Dr. Sri Banerjee. Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with a joint faculty appointment at Ross University School of Medicine. I wanted to go over some of the courses that are available through the World Health Organization. So what actually piqued my interest in the availability of some of these courses was the course that was particularly interesting was Introduction to the Clinical Management of Rape and Intimate Partner Violence. And gender-based violence is something that is ubiquitous, but very important to address. And so this is a self-paced course, and it's the first of 5 courses that will be introducing this. And there's details as to how to enroll, and especially what the course is about. And the course describes the clinical care of people who have been raped or have experienced intimate partner violence in emergencies. Thinking back, one of my students wrote a doctoral dissertation on intimate partner violence. It was more looking at rape and the availability of rape kits within the hospital setting, and how this is not available in a lot of emergency room visits and emergency rooms across the country. And it's very important to be able to accurately collect the proper evidence while you're trying to address the patient's trauma. So here are the details. It actually has not started yet, but here are some of the other more detailed information and what you'll learn, and who this course is for. Health coordinators, medical doctors, clinical officers, midwives, and nurses work in emergency situations. So this can be used in planning care services and training healthcare providers. What are the objectives? Debunk myths about rape and intimate partner violence. That's number 3, but let's start from number 1. Define the concept of gender-based violence, intimate partner violence, and the term rape used in this course. So how is it defined? Discuss the complexity of prevention and response to rape and intimate partner violence in humanitarian settings. So I have a comment to make on that. If you look at a lot of the communal violence that takes place all over the world, a lot of that communal violence is stemming from the culture of violence against women. And some of this violence, about 20 years ago, I studied communal violence that took place in Gujarat, and a lot of violence against women, a lot of body parts being mutilated, for instance, breasts being mutilated and upper body, and so there's a lot of unfortunately there's lots of types of rape, and in fact survivors of rape need to be more closely addressed. So explaining the responsibilities of healthcare providers in responding to survivors of rape and intimate partner violence, but also explaining the relationship between human rights and medical care for survival of rape and intimate partner violence. List the guiding principles for providing survivor-centered care. And this is becoming a buzzword almost. In medicine, you think about patient-centered care, In education, we talk about student-centered care. And then after a trauma survivor, after an individual has survived trauma, then that can, of course, lead to post-traumatic stress disorder, but also in the need for survivor-centered care. And then list the actions required to adapt or develop a protocol or for clinical management of rape and intimate partner violence. And then finally, describing the information needed to provide care for survivors of rape and intimate partner violence. Not all places will have such an extensive understanding of this, but this training is being provided for the sake of better understanding in this topic and global understanding. What I wanted to also show you is some of the other training that is available. Buruli ulcer. That's something that is a chronic debilitating disease caused by Mycobacterium ulcerans. And even though it only affects the skin, sometimes it ends up affecting bone. And how this transmits, nobody knows. Early diagnosis and treatment are crucial to minimizing morbidity. And of course, this is a long-term debilitating disease, so Buruli ulcer needs to be controlled. But if you don't know the cause of transmission or means of transmission, it's difficult to control any sort of outbreak. So this is a 2-hour training. There's actually 33 countries, believe it or not. If you haven't heard this condition, there's 33 countries with this disease, and 15 of them regularly report to World Health Organization. So the aim would be to figure out, and you can do this with a lot of more rare diseases. For instance, Lassa fever is one. But also, so this is a good um, course which has modules: Introduction to Neglected Tropical Diseases, Skin Neglected Tropical Diseases like Buruli ulcer, Epidemiology, distribution, burden, and causative organism, clinical and differential diagnosis, laboratory diagnosis, treatment, complications, referrals, even stigmatization. And I've actually written about this in JAMA about the stigmatization of skin conditions, but stigmatization and socioeconomic impact, public health interventions, and then Module 7 going into surveillance. So I've gone over two of the courses that are within this. There's actually 12 courses that are extremely important. Many of these have to do with IPV and rape. And the management of rape, and also mental health and psychosocial support. One of the interesting ones is sustainable implementation and six steps to do so. And the aim of this course is to provide information on the WHO implementation for handbook. Also, budgeting tool for national action plans on antimicrobial and I can click on this, but so antimicrobial resistance. This is a good one as well, because there's gaps within like globally, and there's actually even a quiz at the end, but this goes to understanding some of the complexities that are part of antimicrobial resistance. So that sums up everything that a lot of the courses that are included within these. A lot of these courses are included. Dietary regulations, regulatory interventions, transitioning to complex risk management and resilient urban futures, harnessing South-South cooperation and learning from COVID-19. Really, really interesting courses. So check them out, and hopefully this provided you with the foundation for some better understanding of global health issues that affect us in the modern day environment. Thank you for listening.